You know when you go to the store and it says one size fits all on those new like one-piece bathing suits or a hat? I got news for you. One size does not fit all when it comes to bioidentical hormone therapy and when it comes to choosing the appropriate bioidentical hormone therapy provider for yourself. So most people may or may not know that bioidentical hormone therapy training is very varied throughout the United States. Let's just bring it into the architect of our residence and where we're speaking from. There are community trainings where you can get certifications, is the best way to say that. Some of them may be research-based, some of them might just be I went to a weekend trip and did some things with providers that taught me, applications of how to put on this patch or to use this pill or this cream. But two large boards out there that you may be familiar with. One is called A4M, the other one is called WLM, which stands for WorldLink Medical Community. I am WorldLink Medical trained and certified. Certified means I actually had to do testing. I had to write responses and take quite a lot of time to show that I had applicable knowledge and retention of what we had learned. And what WorldLink Medical providers accreditation stands on is research-based, peer-reviewed literature from blood-based hormone testing and experiments and results. And there's about 800 plus and growing of us providers that are MDs, DOs, PAs, and nurse practitioners all across the United States and internationally too. And they're in all different specialties, so orthopedics, OBGYN, nephrology. That was kind of weird to see one time, but nephrology, endocrinology, just general medicine, people who are functional or integrative or just anti-aging and holistic medicine practitioners. But in order to be a WorldLink Medical certified provider, you have to go through 80 plus CME, so continuing medical education, training hours, that's a lot, and then take the certification exam in order to earn what looks like a cool little badge that you can put on your website, your social media, etc. But that certifies that you did the work, you read the research, you have adopted the principles, and you have acknowledged that you have very good training. WorldLink Medical is a very neat community because they also associate themselves with a pharmacy out mainly in North Salt Lake City, Utah, that biodistributes its products to all 50 states. And the pharmacists there are very aligned with the trainings of WorldLink Medical. So when you as a client pick up the phone to call the pharmacist about maybe your testosterone prescription, they will also know the similar teachings of WorldLink Medical and the properties and the chemistries and the how-tos if we have some problem solving to do, which really helps the whole bioidentical experience to become very synonymous and feel like you as the client are really in a good community and you're in good hands when it comes to your health. So they use a pharmacy largely that is tit for tat intertwined with their knowledge and training. But then that WorldLink Medical community, once you are an established provider within that system, you may not know this, but we get access to a resource of community support from practitioners where we can actually chat behind the scenes without sharing, HIPAA type information about, tricky cases or maybe a one-off kind of odd reaction and things like that, or the latest and greatest that just came around the block that we might not have known about or had access to if we had just stayed in our little own island of Oklahoma, Tulsa, Oklahoma here. But now I'm talking to somebody, in the UK or in Georgia or Alabama. So that makes it a very, what do I want to say? Resourceful. You're not only, when you're seeing me as a WorldLink Medical provider, seeing myself, you're also seeing someone who is hooked to a community of continued knowledge, continued resources, continued education, and then a support system of not only providers that are like-minded in the way we practice, teach, and preach, but that also pharmacists, which I think is a very relevant piece to the puzzle because these things go so hand in hand. So I wanted to give people a little bit of an idea about what does it mean to have a WorldLink Medical provider at your doorstep. Those are some of the things, and at least the architecture of how the community is shaped and formed, about how we have to have medical literature, research-based evidence behind our practices and our adaptations of bioidentical hormone therapy to clients. But there are certain beliefs that we have that might be opposing, as I mentioned in the way beginning, to a camp or let's say a university, even though they're not a university, a group like A4M. For example, WorldLink medical providers, based on, again, the research and training that we have available to us, largely do not use estradiol on a menstruating female. That might be different from the A4M community teaching. For another example, WorldLink medical providers don't normally see the value in using HCG injections in males that are, on testosterone therapy and might be 50, 60, 70 plus, because we believe that there's diminishing returns on that. The other thing is we don't use Dutch testing. WorldLink Medical has very scientific reasoning for not using Dutch testing, which is urine metabolites, to guide our treatment of dosing changes when it comes to hormone therapy. And again, that's very different than some of the other practitioners that are out here in the bioidentical hormone space that have had varied training from WorldLink Medical. So when you are getting to know the bioidentical community, just be cognizant of the fact that not one size fits all when it comes to you in terms of what you're looking for treatment and therapy, but then also when it comes to the practitioners and what they know. They actually know different things based on who they are certified by, or they might not even be certified, they might have just done a week in training. And I would just encourage anybody looking for a bioidentical hormone therapy replacement provider to ask that question prior to the appointment or in the appointment, so you can better understand what you're getting and what where that practitioner is coming from when it comes to their education and their training.